So today I'm going to talk about two different things. One is spider veins. Ericka, my third daughter, asked me to give a brief discussion about spider veins, how to prevent them. You know, young women don't like to see spider veins on their legs. Not just young people, I shouldn't say that. You know, people of all ages, especially women, don't like to see spider veins on their legs. Cosmetically, it's a nuisance and it can be symptomatic. So how do you prevent spider veins? That's one topic I'm going to talk about. And then another thing I'm going to touch on at the end, I'm going to go into a little diatribe about something I saw yesterday in the office that really, it just spoils everything for us who are taking care of vein problems. And that's excessive use of procedures, and I'll touch on that. But let's kind of talk about the happy topic. How do you prevent spider veins? So to recap, all veins take blood flow back up from the legs. We're talking about leg veins. Take blood flow back up towards the heart and lungs. That's the job of veins. It's a low pressure system. When we sit or stand, gravity's always pulling the vein blood back down towards your feet. And so as a consequence of that, you can develop varicose veins, but spider veins can be part of the varicose vein issues with venous reflux, the valvular incompetence that we talked about where the valves get overstretched could be part of that, but it can be just a primary problem by itself without any significant vein valve issues. And so, typically the spider veins do show up. It can vary, but pregnancy seems to really affect spider veins, but there's multiple risk factors for it. So let's kind of go over it. Probably the biggest risk factor, I think, for spider vein issues is a family history of vein problems or spider veins. Take, for example, Ericka's asked me about this. Ericka's going to be pretty lucky, I think, because her mama has 0 spider veins, and her mom has delivered 4 children. So her mom has no spider veins, and her mom's mom has no spider veins. My mom had some spider veins, not severe. So genetically, she's gifted in terms of her risk for spider vein problems. So I don't think she'll get spider veins, but certainly genetics is a big risk factor for spider vein problems. And by spider veins, by the way, I'm talking about the little skin veins that show up. Typically in women, it tends to show up in the thighs. It can occur in the calf and lower leg, typically in the thighs and inner thighs and outer thighs. And so those veins are what we're talking about. So genetics is a big risk factor. If mom and dad had it, you're at risk for it, unfortunately. But certainly pregnancy is a big risk factor, especially women who get pregnant multiple times or carry, twins or triplets. I think the blood volume changes that ladies go through with pregnancy and the hormonal changes really affects veins irreversibly. And so one of the things I counsel patients' daughters who come in with them is say, hey, you know what, mom and dad have spider vein problems or varicose vein problems, you're at risk for it. So if you're married and not pregnant yet, if you're gonna get pregnant, wear support stockings. So that's one of the preventative tips, is if you're in situations where your veins can become acutely worse because of pregnancy or whatever, wear support hose. So the typical support hose that we recommend for varicose veins is 20 to 30 millimeter mercury pressure support stockings. They should be measured for you, by the way. So over-the-counter ones, they should be measured. If you get them from Amazon or whatever, they should be measured for you, because not everybody has the same size leg and you need the right size for you. So 20 to 30 for varicose veins, 15 to 20 millimeter mercury pressure for spider veins. I think that's plenty. And ideally thigh high. In reality, most people won't wear a thigh high hose because it slips, it's hot and uncomfortable. Pantyhose, that's pretty, it's hot and most people won't wear them. So knee highs, at least knee high support stockings. Really ideally it should be thigh high, but most people won't wear them. So 15 to 20 for millimeter mercury pressure for spider veins, 20 to 30 for varicose veins, and for venous ulcers, stronger if possible, but they should be measured for your size again, because not everybody's leg is the same size. So risk factors again, family history is a risk factor, pregnancy is a risk factor, occupations where you sit or stand for a long time. like, physicians, nurses, cosmetologists, believe it or not, CPAs, truck drivers, that's probably the most common. It used to be postal workers, physicians, and nurses that had the most problem with vein problems, but now it tends to be CPAs and truck drivers. And so risk, occupational risk factors, that's certainly a risk factor for it. And then there's other things, like if you had previous brain surgery, your risk of getting more spider veins. What I counsel people is, look, when you have all these treatments done, you're going to get some more, so be prepared to come back for more touch-up work, especially spider veins. You're probably going to get some more 3 to 4 years down the line. So anyway, prevention-wise, exercising obviously helps to push the flow back up. Weight control, the more weight you carry, the harder your veins have to work. Support stockings when you're on your feet a lot, especially during pregnancy. I suggest to all my ladies that work in my office to wear support toes when they're because they're on their feet all day. Dental hygienists, that's another one that gets a lot of this stuff. So exercising, weight control, prop your legs up, support stockings. And genetics, unfortunately, you can't do anything about. So those are the things you can do preventative wise. After you have treatments for spider veins, wear support hose on your feet a lot. So to try and reduce your risk for having recurrent spider vein problems. So that's really spider veins in a nutshell. Unfortunately, most insurances won't pay for treatments for spider veins because they consider it cosmetic. I don't think that's necessarily true. I think you can have symptoms of spider veins, but they will pay for it if you've had conservative management for varicose veins and have had a vein ablation procedure. But again, not everybody who has spider veins needs a vein ablation procedure. That's just far too aggressive. So that's about the only situation I've seen where insurance will pay it, is if you've had previous treatment for varicose veins and venous insufficiency. Spider veins in a nutshell.